Thank you, Robert. Welcome all. Again, I want to thank our speakers today for being part of our discussion at Washington's Healthcare on Wednesday on testifying before DC Council. And I will have the speakers introduce themselves, and after introducing themselves, answer the first question. According to your experience, why did you do it and how did it go? Dr. Duncan, can you begin, please?
Hi, I'm Laurie Duncan. I'm an internist and epidemiologist. I'm on the board of directors at MSDC, as well as the governor's advisor for the DC American College of Physicians, the DC chapter. And I actually testified in person at an oversight hearing on February 20th, 2020. So, and this was before Chairman Gray and members of the Committee on Health, committee staff, and interested individuals from DC Health and the DC community. So the audience the audience room was huge. And honestly, I was a little nervous as I hadn't made any kind of presentation of this sort to one of the council's committee. But you know what? I felt obliged to do so. I was asked by Robert, and I was also really honored to speak on an issue of well-being, because these issues are so important, and I'm very heavily involved in them, both at MSDC and at the DC chapter of the American College of Physicians. So I prepared my testimony by writing up about 2.5 pages containing what I wanted to say, to make sure that what I was going to say was politically neutral. And this was a really critical thing that had been stressed to me, was that, I can't make an overt political statement, even though I felt very strongly about what I was testifying about. I didn't want to come out and sound like I was either for something or against something. So writing out my testimony ensured that I was knowledgeable about what I wanted to say, and that I had thought it out before I said it. And it also ensured that I wouldn't make any political blunders, which is obviously important when testifying before a political group. And it also ensured that I had a submitted statement for that committee and for any other council members to review after the whole thing was over. So Robert Hay, the executive vice president of the Medical Society, actually met me in front of the building where I was going to testify. And I was, I was nervous, because I had no idea what to expect. I wanted to testify about this. This was something, and I'll go in a little bit later about what I testified about, but this was something, these areas were very important to MSDC, and I wanted to make sure that I got my point across to the committee. And so Mr. Hay was with me the entire time, basically until we said goodbye in the metro, going our separate ways. I had about 5 minutes to testify. I think I ran over my time limit by several minutes, but no one really seemed to mind, as most of the extra time was taken up by Chairman Gray and questions that he was asking. And basically, in general, testifying was a very benign and gentle experience.
Okay, thank you. Same for you, Dr. Worthing. Introduce yourself, and why did you do it and how did it go?
Thanks, Dr. Manuel. My name's Angus Worthing. I'm a rheumatologist in private practice in DC and Chevy Chase, and I have served on the Medical Society board. I've also, most of my volunteering and kind of advocacy has been through my specialty organization, the American College of Rheumatology, and I've done presentations for rheumatologists and had a lot of meetings on Congress and federal agencies, but then 3 times in front of the DC Council. And I would echo what Laurie Duncan just said, that the logistics are somewhat easy, and this is a very kind of quick experience. Each time I've gone, it was, before and after seeing patients down in my K Street office, after maybe an hour or two of preparing testimony. Couple bullet points that I have that I would offer as tips, and then a kind of a story to outline it and bring it home. As physicians, probably everybody on the call knows, we have special evidence and data that our members of the city council need, information that they need, even though they might not know that they need it. In your typical day seeing patients or previous history seeing patients, you hit a snag with authorization of medications or documentation, or patients don't fill the prescriptions for whatever reason. And whatever is going on there that snag is caused by is something that government officials should hear about. And so your next call is to Robert Hay and the folks at DC Medical Society to see if there's legislation, or if this is something that the executive branch can do with regulation or change in the way that bills are enforced. When you get testimony, you're on a blank slate or working with Robert on testimony, always frame your arguments in terms of the patient's access to your care, the patient's access to treatment, because there are a lot more patients literally just voting than there are doctors. And so that's important. In the end, it's worth your time to do this, because I think a half a day or a quarter of a day and some preparation time at night can save not only so many patients from not getting access to your care, but also, kind of saves your profession and makes, as is the mission statement of MSDC, it makes DC the best place to practice medicine. It makes this place fun to be in. And a little bit about going virtual, I did a town hall about supporting doctors during COVID-19 at the very beginning of this a year ago, and it felt more casual. There was a little more access to questions and answers. So of course it eliminates the transportation going down to the Wilson building. To put all these things together real quick, I'll just mention one of the experiences I had and flesh it out, which is I was testifying about the importance of supporting legislation to create a pathway for pharmacists in the district to substitute biosimilars for their originator biologics. And for people to know what those are, it's basically like a generic substitution for biologic drugs, like you've heard of Humira and Enbrel for rheumatoid arthritis. Those biosimilars have started to come out, and we needed a pathway for pharmacists to be able to substitute whatever the patient's insurance has authorized or covered. And then also what's different from generics is pharmacists in 48 other states across the country had been written into law that pharmacists would then notify the prescribing doctor of the substitution. So my testimony was basically supportive of that kind of legislation. It had happened almost everywhere else in the country. But the thing I wanted to mention to you is that the government sent a witness that said something wrong. The executive branch, in my view, sent a pharmacist who testified right next to me at the dais that instead of substituting drugs, the biosimilar, the pharmacist of the District of Columbia should do something that wasn't happening anywhere else in the country, which was send the case back to the prescriber so that the prescriber could figure out what drug the insurance company was covering, and then send a prescription for that biosimilar to the pharmacy. Basically, kind of handing over some of the tasks that have typically been delegated to pharmacists and all these other pieces of legislation. This would obviously put a delay into the system. If you're hearing this and you understand what I'm talking about, this is administrative burden for doctors, and it would push the patient's prescription out days or weeks maybe while the doctor's office tries to figure out what's going on with insurance, whereas it could happen at the point of care at the pharmacy. So because I was there and because the medical society supported me being there testifying, I was able to clarify that for the council and say, this, what's just been proposed is not workable from my vantage point on the front lines, practicing medicine in the district. That's not going to work. And luckily, that worked out for us, and the biosimilars legislation of Substitution Act of 2020, or whatever it's called, has been enacted, and we're waiting for a substitution once we have access to biosimilars. So I have a very positive experience, and to recap, I think it's worth it, and I think it's good to frame things in terms of patient access to treatment.
So quickly, Dr. Worthing, what did you learn that you did not already know? Experience. You over-prepared, you under-prepared, the questions were aligned, you had to keep them focused.
What I really liked was something that might not be happening in the virtual world, which is that after the testimony, when the room was kind of clearing out, we approached the members of the council who were there. Actually, there's one member still there, and he and his staffer had a more informal conversation with us and about next steps for drug pricing and access to treatment. So it's not just, what I learned there is it's not just your testimony, but just being in the room or being on the Zoom lets you not only speak your mind about what the topic at hand is, but then also establish relationships and trust about other topics that you might be helpful for.
Okay, thank you. Dr. Duncan, what was your passion when you testified? What was your passion? And tell us, what did you learn at the end that you had not known prior to testifying?
Right. And so let me just describe a little bit what the room was like, because it was this massive conference room, and it was in person. So Chairman Gray and the committee members and the staff members sat on a dais facing the crowd. And there were little tables set up in the front facing the dais with microphones, and people were called up individually in groups of 5 to come and testify. And so all different kinds of people were making testimony before this committee. So I didn't testify on a bill. I gave a presentation on wellness and well-being. And the first concerned, the first part of the presentation was about the analysis of DC-specific demographic questions that are routinely collected when we renew our DC license. And up until 2018, the 2018 cycle, these demographic data had been routinely analyzed according to HIPAA with identifiers stripped and put out as a report by DC Health so that DC physicians could basically see what the instigators were of burnout and poor health. And for whatever reason in 2018, this wasn't done. And so we, as the Physician Wellbeing Committee and the Medical Society of DC, said we would be happy to partner with DC Health to, that we have the support, we have the analytic capability among our committee members to basically support DC Health. And we proposed a partnership with DC Health to create a report that was similar to previous years. So that was the first part of the report. And secondly, I discussed the recently created Medical Society Physician Wellbeing Program that targets the causes of burnout and offers different channels within the Medical Society to address this. And this program is open to MSDC members, but it's also open and it's available to other physicians within the district. At this meeting, I extended an invitation to both the council members and DC Health to partner with MSDC in developing this program to ensure that all of the goals fit both MSDC and DC Health. So that was the second thing I discussed. And the third thing I discussed briefly was the Physician Help Program, which is an MSDC committee designed to assist physicians suffering from behavioral issues and addiction issues. And I reiterated MSDC's commitment to collaborate with the DC Licensing Board to basically ensure physicians and other health professionals have the resources to combat these issues. So what I learned from testifying was that it really wasn't the big deal that I thought it would be initially. It was pretty benign, that I was not confronted negatively by any members of the committee or anyone from DC Health. And the questions that Chairman Gray answered or asked me were quite thoughtful and presented in a very non-confrontational manner. By writing up my presentation beforehand, I was able to consolidate my thoughts on the issues that I had to present, because I was very, very limited as to the amount of time. And I also made them more concrete and succinct in my mind, so that I wasn't grasping for words and, pausing unduly. I also realized that the issues or points of view that I was presenting may have been novel to those listening. These were issues that we had discussed within MSDC, within the committees, but these were fairly new concepts to the committee and perhaps to the council members. And finally, I enjoyed myself, and I would do it again if I was asked.
That was a good learning experience. You enjoyed yourself. Very good.
I
So
did.
either of you, we, MSDC, we will at times reach out to our members and our board of directors to testify. And I can tell you, as you would know, there are trepidation, people are nervous, concerned. What would you say to those people now that you have that experience?
Sure, I'll jump in, my turn here. I think everybody who has been trained as a physician has gotten up to a podium before. We're not strangers to that. And this is a different kind of podium. Raising your voice in the area of legislation is kind of a special thing as a physician, because I think it extends, so philosophically, extends the Hippocratic Oath of doing no harm on a societal level, so you can actually get things done to prevent harms in the community. I think the society does it really well to shepherd people along, help preparing testimony, help with logistics and being with you, like Dr. Duncan said, like every moment you know where to go, because somebody's saying here, sit here, now stand up and walk over there and start talking. It's almost like you're on a tour. And then the council is very respectful of physicians, even though they might have their own agenda. I think they're listening, and if you don't come and say it, if as they say in politics, if you're not at the table, you're on the menu.
Mm-hmm. Yeah. Dr. Duncan, encouraging others from the society to testify.
Yeah, so these would be my tips for making a presentation, whether it's to the council or to one of the council's committees or somebody from DC Health. And that is to testify on an issue that you feel particularly passionate about and are knowledgeable in, because this will come across in your presentation. Be prepared to answer questions from the committee or the council, which means knowing your subject thoroughly, both sides. Write up your presentation in advance so that you know what you're going to say. Bring an extra copy of your presentation or the outline of what you're going to say to submit for the proceeding transcript. This is really important after the fact, so that you will be accurately represented post-event. And this is in case they're not recording the entire event. Be politically correct. And this is especially true if you are presenting an opposing view. So many times we feel very passionately about something and we don't retain our political neutrality. But I would have to say the most important thing really is to have fun.
Yeah. I would agree. I had my first testimony, as you said, with a batch of 4 or 5, and I was with Dr. Sarah Amershine. It was my first experience. And Sarah, if you don't mind, what was your experience with that testimony, your testifying experience?
I must admit, I've testified at least 5, maybe up to 8 times now. Probably closer to 5 or 6 times, both in person and virtually. Our biggest problem is getting people to take an entire day for 3 minutes of testimony. And Dr. Duncan, you were very lucky that you were not abruptly shut off at 3 minutes, which frequently can happen. So one of the things I would be sure to recommend is that what you write may be different from what you speak in 3 minutes. As you may remember, Dr. Manuel, I'm not going to talk about my credentials. You can read about them because they're this long and I represented that many people. But as a clinician working for the American College of OBGYN or the DC section, it's really hard to get people to do the time. So the one time I got called this week, I was actually at the dentist and ended up rescheduling the dentist's office and she laughed because she's had been at some time head of the DC Dental Society. So she knew the whole thing. But I think you really only have time for your talking points. They like stories. We're not story people as much. We like data, but they want stories. And follow up by offering to help. Unfortunately, they don't contact us enough. I see a lot of errors in what they do. I mean, just misinformation.
Yeah.
You know,
Go ahead. No,
I was just going to agree. I think I had 5 minutes to present because I was presenting before a committee, and the experience was a little bit different because
I've done both. Yes.
Chairman Gray was very encouraging. He wanted to hear what I had to say. I mean, he was leaning forward, nodding his head.
He really does pay attention for 12 hours practically to
Yeah.
all of his he recognizes me by name now and makes comments about it. So he's very gracious about that. I agree. And yes, sometimes as an organization, they'll give you 5 minutes, sometimes 3 minutes. Malcolm Cameron will let you know. We had 31 people for our bill the other day. So
yeah, and this was different because this wasn't a bill. I was actually presenting how we wanted to help analyze some data that were collected from the 2018 renewal of licenses. To date, unfortunately, I don't think much has been done with that. And, of course, then we have another renewal cycle at the end of 2020 that we have to deal with. But we still have the Physician Wellbeing Committee and we have the Physician Health Program.
Great.
So 2 out of 3 ain't bad.
And they rolled back they kept the Medicare federally recently. That was a win for all of us.
I would say that you never know when you're going to be asked questions. So my first experience in testifying, no questions. They moved me right along. Everyone was nice. But the second time that I testified, Chairman Gray, very gracious, he questioned me about one of the topics. And so preparation, failing to prepare is preparing to fail. So each topic you had to know, as you said, both sides of the debate. And I was able to answer his questions and offer more help from MSDC. So that was my learning experience. Make sure, as you said, both sides, the one you support and the one that's opposed to your position. Any last comments? We have 2 minutes. If anyone has any last comments, we welcome them. Okay. Well, I thank you, Dr. Worthing, Dr. Duncan, for sharing your experience with us.
Thank you.
I'm
Thanks
hoping that it will encourage other MSDC members as well as board of directors to participate in this once-in-a-lifetime experience or initial once-in-a-lifetime experience.
I was hoping the junior fellows would sign on and some of the residents and medical students, but it's a tough time for them.
After sign out, they'll watch the recording.
It is a hard time, but do remember just to have fun doing it too.
Yeah.
Have fun. Yeah.
Have a good evening. Thank you.
Experience. Thank you all.
Hi, everybody. Thank you for coming.
Right.
Thank you. So I will move into our open mic, so to speak, experience, advocacy forum. And if anyone have any issue or any topics that they would like to speak about, concerning advocacy, please do not hesitate, join in. I think in speaking with Dr. Worthing and Dr. Duncan on testifying, you guys have noticed I stated I testified before the committee. The last one I mentioned about the licensure and the compact. So having tri-state licensing capability, and that asking that we create a hybrid here for the district, for the DMV quote unquote area. And actually that was the topic that Chairman Gray was interested in the most. And he asked tremendous follow-up questions and asked that did we think it would move faster if we had our own, or would we have opposition, I should say, from Maryland or Virginia. So it was very interesting. I thought beneficial for us as physicians, not just as MSDC members, but I think it was many of our physicians, 11,000 plus, will benefit from having the compact licensure. And if anyone wants to know about that, again, shortly, it's basically creating a tri-state licensing process. So you would only have to go through one application, and the 3 jurisdiction would evaluate the same application and pass it in the same manner.
Let me just say something, because I also worked at Kaiser Permanente in the Mid-Atlantic region, and we had to hold 3 state licenses with 3 different collections of, well, 3 different certificates saying that we could prescribe opiates. And also, and this was nationally, so that one did not cross the borders with the other. So I had to have 3. And also, if a state had a certificate that you had to hold to also prescribe opiates, we had to have that as well. And so that was probably $3,000 every 2 years that we had to pay. And so I really support this bill.
Yeah, I think there's a large support, huge support for that. I think many physicians will be in 2. Some of us, so at Kaiser Permanente, we have to be licensed in all 3. Luckily, they pay for it, and now we have a process where they handle that, but it's still supplying the information and data and answering the questions, but they take it on. It is tedious. You must have your CMEs available and proven. And it can be quite overwhelming when they ask the question of what happened here, if you answered yes instead of no. So I'd say one application would help tremendously. Other bills or testimonies on Dr. Peoples testified on the minor consent for HIV and AIDS on Monday, which what I'm saying is generally there's favor for it. And if those others who want to know that what that is very similar to the emancipation bill for minors to have treatment according to their reproductive interest. We went before DC Council in favor of allowing minors to consent to HIV and AIDS treatment. So if anyone has any questions, please let us know. And on April 21st, the Personal Medical Record Fee Amendment Act will have a hearing. This bill should be of interest to the medical community as it regulates the fees charged for medical records requests, which can be quite expensive and overwhelming for a single practice. That's who can request them and the penalties for not providing them in a timely manner. And I think it's 30 days. So, and lastly, the budget process is underway. MSDC is watching closely to what is funded and what is not, and what's authorized in a draft budget. So with that, I'll open up the floor if anyone has any questions, concerns, recommendations. I think we have 2 additional members besides the 5 of us who are present. No questions. Okay. Well, Dr. Duncan, Dr. Worthing, again, I thank you very much. And I actually, in viewing your testimony, it helped me because I was nervous. I resisted. It was visceral initially, and I would agree with everything you guys say. Preparation was important. But after I did it the first time, it was very easy doing it the second time. I was actually seeing patients. The virtual platform made it very easy. I was seeing patients in the office, and I broke away once Robert said, hey, you have 20 minutes. And it went smoothly, I would say, even with the questions that I wasn't, well, I guess I anticipated, but wasn't expecting. So again, thank you. I appreciate you guys' participation today.
My pleasure.
Thanks for the chance. That was fun.
It's my pleasure. It was great.
Have a good evening.
You too. Bye, everybody.